the number of humans on our planet has grown tremendously from 1 billion in 1800 to over 8 billion in 2022. A true population explosion. While the Earth's population grew, so did our mass consumption society. In healthcare, we experienced also a significant growth in number of patients and medical devices. After the Second World War, we faced a huge global economic development with great technological improvements. These improvements were also implemented in the field of medical devices. Surgical instruments improved. Endoscopes were fitted with 4K chips. Energy devices with complex designs were introduced and robotic surgery platforms entered the market. Medical devices made out of more different mixed materials, replacing reusable devices with single-use products. The hunger for plastics and steel grew as all products has to be manufactured in ever-increasing volumes, with more mixed materials and rare earth metals. The introduction of single-use medical devices, the so-called disposables, in combination with mixed materials, propelled waste streams from hospitals. Where high-income hospitals used instruments for many years, they now dispose high-valued instruments after every surgical procedure. To make people healthier, hospitals use and consume a lot of energy, food and materials. Healthcare in many high-income countries are responsible for 6 to 7% of all CO2 emissions and for a considerable amount of waste. This makes healthcare one of the most polluting sectors. The Green Deal healthcare contains agreements to make the healthcare sector more sustainable by reducing CO2 emissions. The healthcare sector could reduce carbon emissions that occur in the global production chain of medical goods and pharmaceuticals by applying green procurement strategies. Suppliers and healthcare organizations have a responsibility to introduce green strategies. In terms of their impact on people and the climate, they have a corporate social responsibility to help to achieve the ambitions as set out in the Green Deal.